Immuno, I get. What's globulin?
It's a component that they manipulated out of your blood, like dopamine in your globulin. I don't know what that. I can't describe it anymore scientifically. Good question, however. So, aside to this, if you're sitting here thinking, as I thought, it's like, why don't you just like move into a place by yourself and eat better and do better, and then you won't have this situation going on. All easy for us to say, right? So we have to be watchful about our judgment sometimes, because sometimes we have that thought as a nurse or as a person to say, oh my gosh, it's not that hard to figure out. Quit eating late night pizza and quit sharing cups and be smarter about all that, and you will be better and you won't have to eat. But knowledge doesn't equate to compliance, right? You can be all very knowledgeable about stuff, and you know I shouldn't be having this energy drink at 6 in the morning, but I do it anyways. I wasn't looking at anybody, so I don't know what you all do at 6 in the morning. So we just have to know that educate the patient. I know it's tough as a freshman in college to keep all this together. I understand that. Tell me about some things that you like eating, or that you might, maybe we can swap something out of your diet, or maybe we can make some suggestions for something for you that perhaps we can, you know, is there any option? Maybe we can meet with the college, maybe there's an option for you to move into a dorm that doesn't have quite so many people. So there's, you know, as a nurse, maybe we can work with you and come up with some ideas on how to improve your immune system. So your patient needs an immune booster. They can get immunoglobulin therapy. They can get it IV. They can get it sub-Q. There's advantages and disadvantages. I'm going to spend time on that. Strict infection prevention. That just makes good sense, right? I'm in here to get an immune boost anyway. So teaching your patient how to give that to themselves in the home. All the normal teaching that you do as the nurse. Infection control, all that stuff. Teaching about side effects. What you need to know as a student is this slide. So you know what goes with your IVIG treatment sometimes is some side effects, which we don't want. We're going to try to ward those off. So before you even start getting your IVIG treatment today, we're going to give you some kind of antihistamine in the hopes that you don't have side effects. Similar to if we give a patient a blood transfusion and we know that they had a history of a reaction, sometimes we can ward that off by giving you something to begin with to stay on top of it. And in the red box, these should say adverse effects. Important to know. What's the difference between side effects and adverse effects? Tell me again, side effects are expected. I know that this corticosteroid is going to make you a little bit irritable. It's just a package deal. It goes with it. No need to contact us. It's part of what this goes with the territory. Much different than adverse effects. Adverse effects are, yes, life-threatening. These are things we want you to call your healthcare provider about. Not the stuff in the green. That just kind of goes with it. Yeah, it might not make you feel very well, but just know it goes with it. However, all this stuff here in the red, you need to call your healthcare provider about any of those problems. Those are called adverse effects. So yes, you as a student need to educate your patient on when to call the healthcare provider when you're getting an IVIG treatment for what symptoms or conditions or problems. Sort of the magical number for fevers, guidelines for that are 101 or greater. So when we educate patients post-operatively or any other time, we talk about, well, if you have a fever 101 or greater, that's sort of the number that we typically go off of as far as when to notify your healthcare provider. Temperature of 99 or 100, we don't usually get too worried about that. But if you see that number of 101, that's typically a time when we tell our patients to make a phone call in. Because it's probably indicating you have some sort of infection going on. Questions about that section? The patient is going through stem cell transplantation therapy, and you are concerned about what 3 primary risks. Infection. Why would they be potential for infection? Because they have a low white blood cell count. And the neutrophils are a component of the white blood cell count. So all that goes together, absolutely. What else are you at risk for? Bleeding. Why are you at risk for bleeding? Low platelets, right? And you're at risk for oxygenation issues. What lab value are you going to monitor for that? Hemoglobin, primarily, right? Red blood cells. So white blood cells is the umbrella. That could be low. A component of that are the neutrophils, right? Red blood cells, that broad number, a piece of that you're looking at is the hemoglobin, because that's the amount of oxygen that's hanging on the red blood cells when they're circulating. So what risks are they at risk for? Either when we have their bone marrow stripped out, or when they get their new stem cells, even if those stem cells don't take. So understanding those pieces of it, absolutely. What do we give a patient to minimize side effects before their immunoglobulin therapy? Antihistamines. When to call the healthcare provider when you've gotten your IVIG treatment and you're at home now and I've left you and I've given you your treatment. All those things in that red box in the last slide, right? ANC count is 400. I'm going to educate you not to get what live virus is. You know that little list that we had on the slide that we chatted about. If you don't, put that on your little flag of stuff to know. Anybody else see any other, think of anything else that I covered that I didn't hit on? You know when it's appropriate to give immunoglobulin therapy. Anybody we see somebody that's got a compromised immune system for whatever reason. It could be a primary, it could be something else like my niece's example. Questions about any of that? You guys need a break? Need a break?
Yes.
Get over. All coming together a little bit. That's our hope.